Just while this is connecting, if you have any questions about the OET, feel free to pop them into the chat. I'm happy to answer any questions you have on speaking, writing, reading, listening, reading part A, B, listening B, etc. All right, excellent. That's connected to YouTube. Fine, I'm going to pause that. All right, good. Let's get started. Hello, my name is Jay. I'm one of the teachers at E2 Language. E2 Language is an online preparation platform for English language tests such as IELTS and PT and TOEFL, but we are also experts in the OET. We are in fact the OET's only authorized feedback provider, which means that we are trained by the OET to give feedback on writing and speaking. And we're also, looks like we're going to be their first premium provider as well. We've just completed that program. So we know what we're talking about when we look at this stuff. Now, what we're going to do today is we're going to focus on OET writing. Specifically, we're going to look at a writing subtest for nurses, but the principles that I'm going to teach you will apply to medicine or dentistry or physiotherapy or whatever. Although the writing subtests differ significantly between professions, what you need to do in terms of a method doesn't change. It's the same thing. So we're going to look at three things today. We're going to look at how to select case notes, which is extremely important. If you get that wrong, then you may in fact get the entire letter wrong. So selecting case notes is incredibly important. We're going to look at how to transform case notes into grammatical sentences, and we're going to look at how to organize your writing into a logical letter that's readable. These three things, selecting, transforming, and organizing, are the three principles behind a good OET writing letter, okay? You need to get them right. So what we're going to do is, first we're going to look at the case notes, and I'm going to tell you about selecting relevant case notes. Then we're going to look at a completed letter, and I'm going to tell you how I transformed it and how I organized it and why I did that. So let's get started. I'm going to share my screen with you. All right, cool. And you should be looking at my screen here. Fine, here we go. So let's just quickly have a look at the rules. If you're new to this, I should point out, okay, time allowed. Time allowed. How much time do you get? Well, you get 5 minutes. You get 5 minutes reading time, and you get 40 minutes writing time. Now, this 5 minutes of reading time is incredibly important because you need to do some essential things before you start. The first thing you need to do when you sit down in that test and you're given your notes and the reading time starts is to go to the task. Don't read from top to bottom. In fact, what you need to do is this. You need to skip right down to the bottom and you need to read the reading task. Whoops, knew that was going to happen. I'm going to get better at using my technology here. You want to read this part here. This is absolutely essential to you. What does it say? It says, using the information given in the case notes, write a referral letter. This is critical. It could be a discharge letter, could be a transfer letter, it could be something else you don't know. You need to be flexible. And you're writing to a home care nurse, So this is the person you're writing to. I'm just going to kill my video because I think I'm frozen there. Okay, I'm back, fine. Okay, so we're writing a referral letter, we're writing to a home care nurse, and this is the person we're writing to. This is important. You need to understand that you're writing to a person. You're not trying to pass an English exam. If you approach this as, okay, I need to write to please the examiners, well, you can do that, but the easiest way to do that is to think, okay, I'm going to write a great letter to this home care nurse whose name is Sharon Wilkins. I'm writing to Sharon Wilkins. Where does she work? She works at Prestige Home Care, and here's the address. Fine. So the most important thing here is that we're writing to this person, and we're writing a referral letter. Right, we've got that under control. Now we can go back up to the top and we can start to read the case notes from beginning to end to find out about the patient. So after the task, and we know we're writing to a home care nurse, we go right back up to the top and we start to look at the important case notes and we start to think about what is relevant. What is relevant to a home care nurse? What is relevant if you're writing a referral letter? And more importantly, what's irrelevant? What will we leave out? Because just as important as what you put in is what you leave out. Those decisions are critical, and those are the decisions that you make during the reading time. So let's have a think about this. Let me get out my spotlight here. Just bear with me. Cool. So here we go. Here's the patient, Aisha Amari, 75 years old. So she came to the clinic in which I work. Fine. She's a 75-year-old woman. Okay, here's my clinic's address, Westboro Medical Clinic, Westboro. Fine. The name of the patient, Aisha Amari, 75. Braybrook, that's where she lives. Now, admission date, she arrived today. She was discharged today, so she just came to the clinic in one day. She didn't stay overnight. That's important to understand. Admission diagnosis. Well, hold on, let me do this. Okay, so why did she come to the clinic? Admission diagnosis. Left foot turns out on ambulation. There's something wrong with her foot. She's got a weak ankle and she was in chronic pain, burning sensation. I'm going to have to assume that this chronic pain is related to the weak ankle because there's no other case note here talking about a burning sensation. It just looks like her foot and her ankle. So that's the primary medical reason she attended the clinic. Fine. What about the past medical history? Well, she's got mild memory loss. She's 75. She's got blurry vision from retinal damage. She's got hypertension and type 2 diabetes. While I'm going through these case notes, I'm thinking to myself, Sharon Wilkins, home care nurse. Sharon Wilkins, home care nurse. What is relevant for the home care nurse? If we were writing to a physiotherapist, I would be thinking very differently about what is relevant to the physiotherapist. Or if we were writing to a neurologist, what's relevant to the neurologist or a dentist, for example. So that person that you're writing to will inform which case notes you select, okay? Home care nurse about the blurry vision? Yeah, probably, but again, not that important. Hypertension, that's quite important. I'll tell her that. And the type 2 diabetes. Fine. Let's keep looking at these case notes. Paracetamol is required. I imagine that's for her ankle. Deep heat cream, again, probably for her ankle. Self-administered sun calls to remind. Okay, so I probably will tell the home care nurse about the medications, but considering the medication is just paracetamol and deep heat cream, it doesn't seem to be that important. So the other thing that I'm thinking about while I'm looking at this case notes is what is important and what is more important. What's the most important case note? So far, I think the admission diagnosis, the medication's not that important. The past medical history is probably more important than the medications. And why I'm thinking about importance is I'm going to structure my letter, well, for this letter anyway, in order of importance. Let's keep going. I'll answer questions at the end, by the way. So if you have questions, feel free to write them down. Or if you're watching this on YouTube, please put your questions into the chat. Physical review of Aisha Amari. She's 5'8", she's 63 kilos, she's alert and oriented, hearing and speech are within normal limits, skin intact, continent of bowel and bladder. Is that going to be relevant? Assessment. Ambulates independently, walks around independently, in other words. No assistive devices in house, no recent falls, mobile phone with her at all times, pull cord in bedroom and bathroom. Notes. Speaks only Arabic. Okay. Now you need to think to yourself, I'm referring this patient to Sharon Wilkins. I imagine Sharon Wilkins speaks English. Sharon Wilkins sounds like a pretty English-speaking sounding name. This patient only speaks Arabic. How important is that? Because you have to remember that Sharon Wilkins will be visiting Aisha Amari in her house. All of a sudden, this case note becomes very important. And we got some more information. Son, Ahmed, interpreter and information source. He is very involved, shopping errands, finance. He is an accountant at the HSBC Bank. Okay, so now we've got another character in the letter, and that other character is Aisha Amari's son, Ahmed. Now, if Aisha can't speak English, she just speaks Arabic, but Ahmed is basically her interpreter. She carries a mobile phone on her at all times. All of a sudden, this second person has become very important in our letter. And I'm going to show you my letter in a second, and I'll talk to you about why I structured it in that way. So assessment stable, and of course, this is extremely important. This is the management plan. This is what we want Sharon Wilkins to do for Aisha Amari. This is why we're writing to her. We wanted to check the foot or the ankle. She needs a personal assistance for showering. She needs assistance for dressing. Son complains agonizingly long, not to do with the pain, but to do with how long it takes for her to get dressed. Some of the case notes will have tricky little bit of language like that might trick you. Aisha Amari also needs some household chores and laundry, and finally needs installation of assistive devices. Cool. So we've just, in the reading time, we've gone through and we have read the case notes. We started with the task because we need to find out who we're writing to. Then we start to look at the case notes, and the whole time we're reading the case notes, we think about that person we're writing to, and we think about what information that person needs to know. And while the case notes themselves, we think about what's important, what's unimportant, what's relevant, and what's irrelevant. Fine. Just let me check YouTube's cool. All right, YouTube's looking good. Excellent. So now what we're going to do is a little task. I want you to think about relevance. I want you to think about which of these case notes are relevant and which ones are irrelevant. Just spend 30 seconds looking at these case notes. What will you tell Sharon Wilkins? Which case notes will you include in your letter, and which ones will you ignore? All right, this is what I would do. Well, you definitely need her name. Age is important. Residence, she doesn't need to know she lives in Braybrook, or maybe because she's a home care nurse, so maybe. Let's just think about that one. Admission date and discharge date, well, you can just say that she presented today. So we can include this, but very quickly, so we'll include that. Admission diagnosis is going to be really important. So I'm left foot turns out on ambulation, probably not that one, but I'll definitely include the weak ankle and the burning sensation or the chronic pain. In terms of past medical history, well, to be honest, I'm going to include all of this. So that was a bit of a trick for you, but there you go. Let's look at the next set of case notes. So going from past surgical history, again, I'll give you 30 seconds. read these ones up to, okay, up to medications there, up from the top to here. Think about what is relevant and what is irrelevant. Okay, I don't know about you, but this is what I think. I think that the cataract surgery is irrelevant because it happened in 1992. I don't want to trouble Sharon Wilkins with information from 1992. It just doesn't seem relevant. What about the appendectomy? Well, again, no. Family history? No. We don't have any information. It seems irrelevant. The diet seems relevant. So she's on a diabetic diet, low cholesterol. Family brings some meals. Well, maybe. I'll see how many words I have left at the end. Medications, paracetamol, deep heat cream, and that, yes, I will include. But again, as we talked about, the medications are not that important. They're not life-saving medications, for example. They're just painkillers and some cream for her foot. But nevertheless, I'll tell the nurse about that, the home care nurse. Let's have a think about these case notes here. Can I squeeze them onto the page? Yes, I can just squeeze them onto the page. Have a think about these ones. All right, I don't know about you, but I'm gonna physical review. No, whoopsie, sorry. Let me get this right, sorry. 5'8", no. 63 kilos, alert and oriented, maybe. Hearing and speech is fine, or maybe not, I'm not sure. I will just see. Skin intact doesn't seem relevant. Continent of bowel and bladder doesn't seem relevant. Okay, she transfers independently. No assistive devices in the house. No recent falls. Mobile phone. Pull cord in bedroom and bathroom, possibly. Speaks only Arabic, definitely. Son's the interpreter, definitely. He is very involved, shopping, errands, finance. Maybe I'll include it, but just in a very simple way. And it doesn't matter that he works at HSBC Bank and he's an accountant. That's irrelevant. Stable, fine. Okay, let's move on to the management plan. I'll do this separately because this is important. Let's have a look at the management plan. Usually you will always have to include all the information in the management plan because that's basically the purpose of the letter. So let's have a look at this. Oops. And okay, so yes, we want her to check the foot. She needs personal assistance. I'm going to include this timing into the letter. She needs help with dressing or chores. So I might include these two together. And this is a really important one. Needs installation of assistive devices. Fine. Cool. So we've just looked at the case notes. Now, you can do that ticking in your head during the reading time. You don't actually have to tick the case notes. You can as soon as the writing time starts. But what you really need to do is utilize that 5 minutes of reading time, read the task, find out who you're writing to and why you're writing to them, then go through the case notes, think about what's relevant, what's irrelevant, think about importance, and you can do this all in your head. So then when you start to write, you're just ready to go. So let's have a look at the letter. Okie dokie, here is my letter. Let's just start with some basic stuff here. Let's have a think about how I wrote this. Sharon Wilkins, comma, Prestige Home Care, 393. Actually, you don't need the comma. That doesn't matter. You can have the comma or not, it doesn't matter. Here's the address, 393 Victoria Road, Newtown. Fine. Let's just think about this for a second. Where did I get this information? I got this information to write the beginning straight from the task. Straight from here, I have just copied this, Sharon Wilkins, Prestige Home Care. Now I've included this just because it mentioned it in the task, 393 Victoria Road, Newtown. I've simply copied that and I've put it here up the top left-hand corner. Fine, let's move to the second part. Again, just some technical stuff. This is stuff you just memorize, and this is, you will use the same format for every letter you write. This is just technical stuff for the format. So let's look at this. So we've got Dear Sharon Wilkins. Now, Sharon, it didn't, in the task, it might say Mrs. or Ms. or whatever, but in our task it didn't. So I'm just going to include her first name and last name and say Dear Sharon Wilkins, comma. Fine, we've got that. What about this part? Well, again, another little technical thing. Regarding Aisha Amari, and again, we don't know if Aisha is, well, Aisha is definitely a female's name. Maybe you know that, maybe you don't. Well, we don't know if she's a Mrs. or a Ms. or anything like that. So I'm just going to include her full name, comma, 75 years old. Just a little technical thing here is we've got 75 years and we've got little dashes between. Just copy this. 8 years old with dashes. 10 years old, 21 years old. Same thing, it's always the same. So it's number, dash, years, plural. Just use this format. There are other ways to do it, but why make it tricky? Just use that format only. Now we move into the writing part. All of that you should just be able to do in 2 minutes. Just quickly copy down the address, Dear Sharon Wilkins, comma, regarding Aisha Amari, comma, 75 years old. Now you have to actually start to use your knowledge of English language and your understanding of those case notes in order to construct your letter. And this is where the word count starts, by the way. This is where the word count starts. So let's have a close look at this. This opening sentence is really important. You want to get this right. And you can kind of memorize a bit of a structure for this one. That's fine. I'm writing to refer name of patient into your care. And then we keep going. We don't put a full stop. We're going to create a long, complex sentence here. Who has been suffering from main medical issue and requires some personal assistance in her home. So what have we got here? Here we've got main issue, chronic ankle pain. And here we've got reason for writing. So this, in fact, this opening sentence can be, well, not necessarily memorized, but this structure is quite good. I'm writing to refer the patient into your care who has been suffering from chronic ankle pain and requires some personal assistance in her home. Fine. It's an excellent opening sentence. Why? A few reasons. We mentioned the main medical issue of why we're writing, and we mentioned the reason for writing. We're writing because she's suffering from ankle pain, and we're writing because she needs your help. And we can put that into one single sentence. Good. The only little grammatical thing is this. Just let me point to you. I talked about writing a complex sentence. We could write this. We could write, I'm writing to refer Aisha Murray into your care, and we could put a full stop. And we could start a new sentence and say, she has been suffering from chronic ankle pain and requires some personal assistance. But we didn't. And instead what we did is we used this little word who, with no full stop, who has been suffering from chronic ankle pain. It's important to get the first sentence right because this is the one the examiners are going to first read. And if it's perfect, then their evaluation of your writing will be improved. Let's now think about the second paragraph. Let me disappear here so I'm not covering the screen. Okay, second paragraph. What I'm going to do, it's going to follow on from this first paragraph. But what I'm going to do, I'm going to preface, I'm going to tell the reader what this paragraph is about. And I'm going to do that with a phrase like in terms of her medical history. So then the reader knows that this paragraph here is about medical history. Because I've told the reader in this first little clause, this first few words, what this paragraph is about. In terms of her medical history, Aisha suffers from hypertension and type 2 diabetes, for which she is on a particular diet. I didn't specify the diet, I just said she's on a special diet. While her hearing and speech are good, she does have blurry vision as a result of retinal damage. So I've just quickly, there are different ways to structure these letters, and it all depends on the case notes. But what I've done there is outline main medical issue and then gone for a quick medical history. What you can also do is do main medical issue, more information on main medical issue, but ours didn't really have that, and I'm saving it for the management plan. So the way that I'm thinking about this for Sharon is I'm saying, hi Sharon, Aisha Amari needs your help because of her ankle. Let me quickly tell you about her past medical history. Let me quickly tell you that she doesn't speak English, but she has a son. And let me then tell you what I need you to do for me and for Aisha. So let's look at the second paragraph there. Let me scroll down. So I've outlined the main medical issue, and I've quickly outlined the medical history. Let's look at this third paragraph here. Okay, this is an important one because what I've done is I've collected a bunch of case notes together. It says, it's important to know that Aisha does not speak any English. In brackets, she speaks Arabic. She also has some memory loss. Her son, Ahmed, is her interpreter and main carer. She carries a mobile phone on her at all times to communicate with Ahmed. Ahmed also reminds her of a medication, which is currently paracetamol and deep heat cream for her ankle. Right, so what have I done? I've put, okay, she doesn't speak English. I've put that case note in here. And she has memory loss, which is kind of related. In other words, it's going to be difficult for Sharon to communicate with Aisha. Then I've introduced Ahmed. Let me start a new one here. I've introduced Ahmed here. He's her interpreter and main carer. Now I've said she carries a mobile phone on her at all times to communicate with Ahmed. That's important. Ahmed also reminds her of her medication, and then I've quickly mentioned the paracetamol and the deep heat cream. It's not a main thing, but I've just included it in that paragraph. Fine. So now you can see that the letter needs to have a logical structure. It needs to be sequenced in such a way that it tells a story. You don't want to jump around from topic to topic. You don't want to say, Aisha's on this medication. She has a son. Aisha had her cataracts removed. Aisha did this. No, you want to collect the case notes into logical paragraphs. So when the reader's reading it, it makes sense. Here's a paragraph about the past medical history. Here's a paragraph about her son because she doesn't speak English, and you need to know about him because he's her only form of communication. Let's now look at the fourth paragraph here. This is where I've taken the management plan and turned it into a paragraph, okay? Let's have a look here. Okay, so I've got this paragraph here, and again, it will be logical. As there are no assistive devices in Aisha's house, would you kindly follow up with her to ensure that they are installed? So again, this is what I felt was in terms of the management plan was extremely important, the installation of these assistive devices. But there's more information in the management plan. She also requires your help with dressing, domestic chores, and showering 2 days per week, 4 hours per day. Now you might see what I've done there is I've combined, if we have a look at the case notes and the management plan, there was one case note about dressing, there was one case note about showering, there was one case note about doing chores, but what I've done instead is I've combined them into a single sentence that says she also requires your help with dressing, domestic chores, and showering. So you can do that. You can take 3 similar case notes, blend them into one sentence as long as they're all related, and this will decrease your word count, which is a good thing. Cool. And then finally, we've got this sentence you can memorize. This is just a formality, a certain way of writing, and it looks like this. Oopsie, where am I? Need my thing. There we go. Please do not hesitate to contact me for any assistance you require regarding this patient. You can you can memorize. All of this up here, you can't memorize. This is where you need to be flexible. This is where you need to have good vocabulary, grammar. You need to be able to turn those case notes into grammatical sentences. Yours sincerely, comma, registered nurse. This was in fact 202 words, not from beginning to end, because that's not where they do the word count from. They start to count the words from here, from the body of the letter, right down to here. Now, the official word count is between 180 and 200. If you go over slightly, it doesn't matter, but you should aim for between that 180 to 200 words. And that is how you should approach these letters. Let me just stop screen sharing. So what have we done? Okay, there are 3 principles for OET writing that you need to be aware of. First is selecting relevant case notes. On test day, you're going to have this many case notes. You need to disregard or not include a lot of the case notes. Some of them will be there to trick you. Like, let's say you're writing to a physiotherapist about helping somebody with their knee reconstruction. Some of the case notes will be about a skin problem. Does the physiotherapist care about the skin problem? Well, it depends, but probably not. You need to select case notes for the person you're writing to. The other thing about selecting is you need to think about importance of case notes. While you're reading, you're thinking, okay, this is life-saving medication. Obviously, the importance should be emphasized. If it's just painkillers because somebody has a headache, well, it's not that important. I'll mention it, but maybe embedded in the paragraph or at the end of the paragraph. Transformation of case notes. All of the case notes will not be in grammatical sentences. It's your job to create grammatical sentences. And I think probably what is the most important thing after selecting, or maybe more important than selecting case notes, is organizing case notes into a logical story. We just saw my letter where I introduced the main medical issue. I quickly told Sharon about the patient's past medical history. I then spent quite a bit of time writing to Sharon about her son, Ahmed, and the fact that Aisha doesn't speak English. This is important because Sharon's going to be visiting Aisha in her house. I expanded upon that before finally talking about the management plan and thinking about what was most important in the management plan for Sharon Wilkins. There you go. That's it. We've just got a little question here from Jackie Lee who says, home care nurse is the same as a community nurse? Yes, I believe so. I'm not a medical practitioner and I created this one. So home care nurse, community nurse, I believe they're the same thing. All right, let's go to Q&A. If you have any questions, feel free to type them into the chat. If you're on YouTube, don't forget to give this video a thumbs up and subscribe to our channel so you can get more and more of this. So do we have any questions? Okay, Jackie's got a question that says, I haven't taken the OET before. How to prepare, where to start? All right, the OET is quite a complex, all English tests, IELTS, PT, TOEFL, OET, they're complicated. The first thing you need to do is to understand the test. You need to understand every section of the test, and you need to understand the different question types within the test. The OET is specific to medical practitioners, so it's kind of easier in terms of vocabulary because you might be more familiar with the topic, but that's where it ends. In terms of skill building, it's going to be the same as the IELTS or the PT, for example. How to begin approaching the test? You need to understand, you can work it out for yourself, that's fine. You can read all over the internet, you can read the official pages of the website to understand what the test is about. Far easier to approach an expert like me or e2language.com to have them explain to you what the test is about. As part of our course, we have overview lessons that describe each part of the test. Second thing you need is methods. You need to understand how to answer each of the questions or each of the sections of the test. For example, in the OET, reading part A is a reading test that's done in 15 minutes. It's extremely quick. You need to have a method. You need to understand how a step-by-step process to answer those questions. Also, listening part A requires a method. Writing requires a structure, which I've just shown you. The third thing you need to prepare well is feedback. You need to get feedback on your writing. You need someone like me or one of the other expert teachers here to look at your writing and say, good, good, bad. You need to fix this. Because some people, they may be great writers in English, the grammar's great, the vocabulary's great, but if they don't structure it correctly or if they misinterpret the question, whatever it is, it can be extremely problematic. So 3 things you need. You need practice materials, good practice materials, you need methods, and you need feedback. That's how you approach an English language exam. Just quickly, a little story. I was tutoring a guy yesterday, a nurse, not yesterday, last week, and he was extremely confused because I, or E2 Language, had been teaching one thing and the OET had been teaching the same thing, the official OET, but another website had been teaching him a different thing, a different method to approach the test. In fact, the practice materials that he had downloaded from this particular website were completely misleading. They were wrong materials. And so this poor guy is getting extremely confused because he's looking at the official material and he's looking at E2 Languages material that say this, then he's looking at another website that says this, and he's thinking, oh my God, I don't understand. And so I had to say, listen, I'm sorry, but you're going to have to put this stuff in the bin, in the trash, because the tests are difficult to write, let me tell you that. Another question from Reem Al-Nakib. If there are long dated history regarding the main medical issue, how can we organize all of these dates? Okay, good. There are 2 main ways to structure your letter or to organize your letter. The first way is by order of importance. Main medical issue described further, some additional information, and then the management plan. That's the first way. You structure your letter by order of importance, which is what we did today. The second way that you might have to structure your letter is by time or chronologically, which means sometimes you see those case notes where they have the dates, like on the 21st of January, she visited with this complaint. 3 days later, she came with this complaint. 1 month later, she had this complaint. And so in that sense, you have to think about structuring your letter in terms of time. So you could bundle all the January case notes in. You could say, dear reader, Aisha Omari presented in January with these issues. In February, the problem had escalated to here. I'm writing to you because of this. 2 ways to structure. 1, importance. 2, by time sequence. So you need to think about that. You need to make that decision on test day because you don't know what case notes you will get. Jackie Lee, should we put a space between the paragraphs or not? Look at this letter. let me screen share with you again. Cool, that's fine. Okay, this is how you should structure your letter. This is a perfect example of format, okay? Let me just get out my thing. This is how you should structure it, including the spaces. So here we have the address to the recipient of the letter, the name of the medical clinic, and the address of the recipient. Dear Sharon Wilkins, full colon, Aisha Amari, comma, age of patient, opening sentence, space, 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 space. You are actually graded on the layout of your letter. Paragraphs, closing sentence, space, yours sincerely, space, your name, or just RN for registered nurse. They don't look at your name, and you don't need to include the word count. I don't know if they can't look at the words or not. Follow that format for your letter. That's perfect. That is a perfect letter. Don't do anything else. Any other questions? Just looking on YouTube at the questions. Can I use abbreviations in writing? Yes, you can use common abbreviations. Don't use uncommon abbreviations. If you have an abbreviation that is simply uncommon, don't use that. Common ones like within normal limits, WNL, or blood pressure, BP, for example, that's fine. That's fine. Common ones are fine. Uncommon ones are not fine. What else have we got? Okay, so Just Meet says, I gave the OET and I was confused in writing because there was a lot of information and it was about referring two people to the aged care home. How can I write this type of letter? I would need to see the case notes, but it would follow either one of those. I would need to see the case notes. I would need to write it. You need to be flexible on test day. It's not just about memorizing structures. It's about being able to write in different situations to different people. And this is what you need to do in your job anyway. Again, one of the things I highly recommend is feedback on your writing. Okay, Priya says, Jay, is it okay to add an address if the address is incomplete? The address will not be complete. You've probably been looking at bad practice materials. In the official materials and in the materials you get from OET Language, the address will be complete. So don't worry about that. OET Reading Part B, somebody's asking about. That's the multiple choice where you have to read an academic article and answer those sorts of questions. That requires practice and good practice materials. It also requires a bit of instruction as a method, so that's important. OET Reading Part B, Part A really requires a method. I'm going to leave it there. Thank you very much for coming along. That was good. If you're watching this on YouTube, subscribe, click like, and come across to e2language.com to sign up for the next webinar. Also sign up for free. And if you're a free member, think about upgrading so you can get the practice materials, the methods, and the feedback you need to succeed. I'll see you guys later.